Today, we're diving into the respiratory system, which is one of the most essential systems for sustaining life. Without oxygen, our cells cannot produce enough energy, and without a way to remove carbon dioxide, the body quickly becomes toxic. This lecture will walk us through the structures and functions of the respiratory system, the mechanics of breathing, and what happens when things go wrong. The respiratory system's main job is gas exchange. Every breath brings oxygen into the lungs where it diffuses into the blood and removes carbon dioxide, which is a waste product of metabolism. This constant exchange is tied directly to cellular respiration, which is the process of the mitochondria that takes and produces ATP. We'll see how inhalation and exhalation are tightly linked to maintaining homeostasis and keeping our internal environment stable. Respiration isn't just about breathing. We can break it down into different levels. Ventilation, which is simply moving air in and out. External respiration, which is the gas exchange between the air and the blood in the lungs. And internal respiration, which is the exchange between the blood and tissues. And cellular respiration, which is the final breakdown of glucose in the mitochondria. It is important to remember that the respiratory system also helps us produce sound, which allows us to communicate. Anatomically, the respiratory system is divided into the upper and lower tracts. The upper tracts includes the nose, nasal passages, sinuses, and the pharynx. The lower tract includes the larynx, trachea, bronchi, bronchioles, and the lung. Each part plays a unique role, from filtering and humidifying air to serving as the site of gas exchange. Understanding this division helps us map out airflow from the outside environment into the deepest parts of the lung. The nose and the pharynx are more than just air passages. They filter out particles, trap microorganisms and mucus, warm and humidify air, and even house the smell receptors. They also help us shape our voice through resonating chambers. This means that before air even reaches the lungs, it already has been conditioned and screened, showing us how protective the system is against the outside environment. Now we moved into the lower tract. This is where the actual exchange of gas happens. The larynx, trachea, bronchi, and lungs form the passage that delivers air deep into the alveoli. Each step narrows the passageways, prepping air for the final destination. The larynx has two important jobs. It keeps the airways open and helps produce sound. The epiglottis is a small flap of cartilage which acts like a traffic controller, sending air into the trachea and food into the esophagus. The vocal cords inside the larynx vibrate as air passes, which allows us to speak, sing, and even yell at times. The trachea or windpipe is a sturdy tube reinforced with C-shaped cartilage rings. These rings prevent collapse, keeping the airway open. It is lined with ciliated cells that trap particles and sweep them upwards towards the throat, where they can be expelled. If something bypasses this system, we rely on the coughing reflex, which is a powerful mechanism to clear the airway in an instant. The trachea branches into the bronchi, and these divide into smaller bronchioles. As air moves deeper, the structures lose cartilage support but keep smooth muscle and cilia. These branches not only transport air, but also warm, humidify, and clean it further. Smoking damages the cilia, which is why smokers often develop a characteristic cough as their body struggles to keep debris without this defense. The lungs are the ultimate destination of inhaled air. They are wrapped in the protective pleural membranes that allow smooth movement during breathing. The right lung has 3 lobes, while the left has 2, leaving space for the heart. Although they function as a pair, each lung can work firmly independently, which is helpful if one is damaged. At the end of each bronchiole lies a cluster of alveoli, which are tiny air sacs with walls just 1 cell thick. They provide enormous inner surface area, which is about the size of a tennis court, for diffusion of gases. Special cells secrete surfactant, which reduces surface tension and prevents collapse. Premature infants often lack surfactant, leading to respiratory distress syndrome, but treatment today can dramatically improve survival. The alveoli would be useless without the blood supply. Pulmonary arteries bring deoxygenated blood from the right side of the heart into the capillaries surrounding each alveolus. As oxygen diffuses into the blood and carbon dioxide leaves, venules carry oxygenated blood back to the heart. This constant partnership between the lungs and the heart is what keeps tissue supplied with oxygen. Breathing relies on pressure differences. Gases move from high to low pressure. When the chest cavity expands, lung volume increases and pressure drops, drawing the air in. When the chest relaxes, the opposite occurs and air flows out. It is a simple but effective system driven by the physics of gases. Let's put the mechanics together. At rest, the diaphragm and intercostals are relaxed and no air moves. During inhalation, the diaphragm contracts downward and the rib cage lifts, expanding the thoracic cavity and pulling air in. During exhalation, the muscles relax, volume decreases, and the pressure rises, and air is pushed out. This cycle repeats every second automatically, sustaining life without us even thinking about it. We can measure lung function by looking at volumes. Tidal volume is the air in the normal breath, which is the volume of air inhaled and exhaled in one single breath. The dead space is the air that fills the conducting airways and never participates in gas exchange. Vital capacity is the maximum volume we can exhale after a deep breath. These are often tested by a spirometer and can help detect lung conditions early. Beyond the normal breath, we have a reserve volume. Inspiratory reserve is the extra air we can inhale after a normal breath. An expiratory reserve is the extra we can actually push out. Even after maximum inhalation, a residual volume remains in the lungs to keep the alveoli open. These measurements often give us a complete picture of how well our lungs are functioning. Gas exchange begins once air reaches the alveoli. External respiration happens as oxygen moves from the alveoli into the capillaries and carbon dioxide moves out. Internal respiration is the same process at the tissues. All of this occurs through diffusion, which is a passive process that does not require ATP. The system relies on gradients, always moving gases from higher to lower concentrations. To understand diffusion, we use the idea of partial pressure. Each gas in the mixture exerts its own pressure. Oxygen diffuses into the blood because its partial pressure is higher in the alveoli than in the capillaries. Carbon dioxide does the reverse, leaving the blood where its partial pressure is higher and entering the alveoli. These gradients are the engines of respiration. Breathing is powered by skeletal muscles, mainly the diaphragm and the intercostals. These muscles are controlled by motor neurons under the direction of the nervous system. The brain adjusts the rate and depth of breathing to maintain stable levels of oxygen, carbon dioxide, and pH in the blood. This automatic regulation ensures homeostasis even as our activity levels change. The rhythm of breathing comes from the medulla oblongata. Neurons here send impulses every few seconds to stimulate breathing muscles. If these signals are disrupted, breathing becomes impaired. This shows us just how critical neural communication is for something we often take for granted. This is where we connect physiology to real-life health. In an opioid overdose, signals from the medulla are suppressed. The diaphragm and intercostals no longer receive commands to contract, and breathing slows or stops. The brain also fails to respond to rising carbon dioxide levels. This is why respiratory arrest is the main cause of death in overdoses, but medications like naloxone can reverse the effects very, very quickly. Although breathing is mostly automatic, the cerebral cortex allows some voluntary control. We can hold our breath, control airflow for speaking or singing, and even alter our rate temporarily. However, this control has limits. Eventually, the automatic centers take over to prevent dangerous oxygen loss or carbon dioxide buildup. Respiratory disorders often involve reduced airflow. Asthma is caused by spasmodic contractions of the bronchi, usually in response to allergens, and is treated with bronchodilators. Emphysema permanently damages alveoli and reduces their elasticity, making exhalation difficult. This lowers surface area for gas exchange and creates breathlessness. Both conditions show how sensitive the system is to changes in airway structure. Bronchitis is the inflammation of the bronchi, often triggered by smoking or pollution. Chronic bronchitis paired with emphysema is grouped as COPD, chronic obstructive pulmonary disease, which is a major cause of illness and death worldwide. Patients experience persistent cough, phlegm, and shortness of breath. These conditions remind us how environmental exposures like smoke directly damage the respiratory system. Another condition is cystic fibrosis, which is an inherited condition where thick, sticky mucus clogs the airway. This makes breathing difficult and allows frequent infections. It doesn't just affect the lungs, but also other organs. Advances in treatments have improved outcomes, but it remains a serious disease. The most common respiratory issues many of us face is a cold. It is caused by over 100 different viruses and typically affects the upper respiratory tracts. Symptoms like coughing, sneezing, and congestion are the body's defenses at work. Antibiotics do not help because these are viral infections. Most colds are mild, but they remind us of how vulnerable our respiratory passages are to pathogens. Influenza, or the flu, is the most serious than the cold. It causes fever, body aches, and fatigue, and can lead to conditions like pneumonia, especially in children and older adults. The flu virus changes often, which is why annual vaccines are recommended. Historically, influenza pandemics like the one in 1918 have caused massive loss of life, showing the power of respiratory pathogens. Pneumonia occurs when the alveoli fill with fluid due to infection, making gas exchange very difficult. It can be caused by bacteria or viruses and lead to fever, chills, and chest pain with a productive cough. It's one of the leading causes of death in the United States, especially in vulnerable populations, especially the elderly. Treatment depends on the cause, but prevention through vaccines and hygiene is also key. Tuberculosis, or TB, is caused by Mycobacterium tuberculosis. It can be active with symptoms like coughing and weight loss, or dormant and reactive later. Diagnosis often uses a skin test or chest x-ray, and treatment requires a long course of antibiotics. Although rates have dropped in the United States, TB remains a global health challenge due to drug-resistant strains. Botulism is rare but deadly. It results from a bacterial toxin often found in improperly preserved foods. The toxin causes paralysis of skeletal muscles, including those needed for breathing. Without intervention, respiratory failure occurs. COVID-19 is caused by the SARS-CoV-2 virus, which is now a household name. Symptoms vary widely, from mild to severe, with some patients experiencing loss of taste and smell. In severe cases, the infection causes pneumonia, which is a significant lung damage. Those with underlying conditions like diabetes or heart disease may face higher risks. The pandemic has shown how deeply respiratory infections can cause and disrupt societies worldwide. Lung cancer arises when abnormal cells grow uncontrollably in the lungs, blocking airflow and disrupting gas exchange. Smoking is the leading cause, responsible for most cases. Radon and workplace exposures like asbestos also contributes. It's one of the most deadly cancers, responsible for a third of all cancer deaths in the United States. Prevention by reducing exposure to carcinogens is critical. Mesothelioma is cancer of the linings of the lungs, often linked to asbestos exposure. Symptoms may not appear until decades later, making it difficult to catch early. Once diagnosis, survival is often limited to a year or less. This disease illustrates the long-term impact of environmental exposure on respiratory health. A pneumothorax often occurs when air enters the pleural cavity, often due to injury causing part of the lung to collapse. This prevents proper inflation and gas exchange. Treatment involves removing the air to allow the air to lungs to re-expand. Atelectasis is when the alveoli collapse or fill with fluid, leading to reduced gas exchange. It can occur after surgery, with anesthesia, or due to insufficient surfactant. While not always life-threatening, it can complicate recovery and worsen respiratory functions. Preventing atelectasis involves encouraging deep breathing and mobility after surgery. Here we see how the respiratory and cardiovascular system are intertwined. In congestive heart failure, the left side of the heart cannot pump efficiently. Blood backs up in the pulmonary capillaries, raising pressure and causing fluid to leak into the alveoli. This fluid buildup makes gas exchange very difficult, leading to shortness of breath. Treatment focuses on strengthening the heart and reducing fluid loss.